The emergency of the coronavirus global pandemic has disrupted the treatment of non-communicable diseases in many countries as the world focuses on the latest global crisis. Health experts, however, argue that the non-communicable diseases are claiming more lives than that at the moment, and that it shouldn't be ignored despite the coronavirus outbreak. Let's have more details of that in this report.
The COVID-19 pandemic and non-communicable diseases have brought about a deadly interplay. Services have become increasingly disrupted as African countries move from sporadic cases to community transmission of the coronavirus.
Because of COVID-19, there is a bigger impact on all the other diseases. We mainly call them as non-communicable diseases especially. The highest mortality rate in today's world is because of non-communicable diseases. Even in Africa, by 2021, that is next year, it is being said that the biggest cause for death would be not the infections but the non-communicable diseases like diabetes, hypertension and other diseases like cancer and respiratory illness.
According to the latest survey released by WHO, the impact is global, but low-income countries are the most affected. Many African countries are reportedly experiencing disruption in services for hypertension treatment, with 49% for treatment for diabetes and diabetes-related complications, 42% for cancer treatment, and 31% for cardiovascular emergencies.
Because of COVID-19, most of the hospitals are taking COVID cases, and then it is a bigger impact on the patient who is already immunocompromised with diabetes, hypertension or any kind of cancer for that matter. We are not able to admit them because of having COVID-19 cases in the hospital because they are more vulnerable to get cases of corona.
Doctors say it will take some time before countries know the full extent of the impact of disruptions to health care during the COVID-19 pandemic on people with non-communicable diseases. What remains clear is that not only are people with non-communicable diseases more vulnerable to becoming seriously ill with the virus, but many are unable to access the treatment they need to manage their illnesses.